Finally, for this week, we'll go over the development of the urinary tract. Now, the urinary tract is interesting because we make a couple structures we don't actually use. So to start with, the intermediate mesoderm is going to differentiate in the sacral region into the mesonephric or Wolffian ducts. Now, even though we're currently talking about kidneys we're not actually going to use, the Wolffian ducts, or the mesonephric ducts, depending on what you want to call them, we will use. Okay, so keep those in mind, particularly for when we get to chapter 16 on reproductive anatomy. So from there, we get pronephros. So these are, again, intermediate mesoderm-derived structures, and they look a little bit like some of the nephron-like structures you see in lower vertebrates, which is how they get their name, and probably an evolutionary hiccup, something that we used at one point we don't use now. But they develop really for a short period of time, and then by day 25 they've regressed and they're gone. Next up, we form the mesonephros. Now these are more column-like structures that follow the path of the mesonephric ducts. And they're actually functional for a short period of time. In females, they will ultimately regress. They do stop functioning around week 10, and then in females, they regress entirely. In males, a portion of the mesonephros hangs around to form part of the male reproductive system, which we will talk about when we get to chapter 16. Finally, we get to the metanephros, which are the kidneys we're actually going to make use of. So on day 28, we see the formation of ureteric buds, and they're derived from the caudal end of the mesonephric duct. Okay, so we get this budding as we have seen with several organ systems in the past. Now, once the buds form, they start to branch, and that should be happening by day 32. So we see from this ureteric bud, we get the ureters and the collecting ducts. And as they continue to branch, they're going to start to coalesce into these structures called major calyces and minor calyces, which will ultimately be part of the adult kidney. So they're just groups of these ureters and collecting ducts all sort of merging into these one structures. But the branching itself continues until by week 32, we have all of the collecting ducts formed. Now, at the same time, concurrently to the derivatives of the ureteric buds, we have the cap mesenchyme. Now, the cap mesenchyme is forming at the tip of each branch that's coming off of the ureteric buds. And again, so we're back to day 32. And from this cap mesenchyme, we get nephrons differentiating. And they're actually functional by week 10, and the development of them is complete by birth. So you have fully functioning kidneys at birth. Now, the kidneys are important because the kidneys are what's making fetal urine, and fetal urine is amniotic fluid, without which you don't get proper lung development and a variety of other things. So you need to get those kidneys up and running because eventually the placenta is not going to be able to keep up with amniotic fluid production at the rate that the baby needs. The kidneys will have to take over. Now, the last bit for the kidneys is they aren't actually formed at the place they need to be. They're formed sort of in the pelvis, but they need to move up more towards the lumbar region. And that all happens during weeks 6 to 9 as they sort of migrate slowly up in the sort of from caudal to cranial end. However, on occasion, they don't migrate the way that they're supposed to. And so the first picture here is normally migrating kidneys. The second is a pelvic kidney, a kidney that's stuck in the pelvis. It would still be functional, it's just not where it's supposed to be. But then you can also get this horseshoe kidney, which is the last one. Now, horseshoe kidneys are really interesting because they can be quite functional, and folks that have them may not show any symptoms, and it may be something that's not discovered until there's sort of an X-ray for some other purpose or imaging for some other purpose, or in some cases may not be discovered at all. I should point out, though, before we move on, that the formation of the horseshoe kidney is not it's not formation of kidney tissue that never separates, because that's not how kidneys form, right? They form off of these two buds. No, this is actually merger of the kidneys as they're moving in the cranial direction, which is kind of an interesting etiology. the reason that kidneys relocate and how that's achieved is really not well understood. So we need to talk about the bladder, and that's sort of our last topic for the urinary tract system. So this is going back to what we talked about at the end of our digestive system lectures. We're back to our cloacal region that's getting separated. So just as a reminder, the urorectal septum is what divides the cloacal region into the anal rectal canal, which we covered during formation of the rectum, and the urogenital sinus, which is going to be sort of a shared structure from which we get both urinary tract derivatives and reproductive derivatives. So, the bladder is going to form from the urogenital sinus or maybe from the lower portion of the allantois. We don't really know. But at any rate, we get the bladder forming. And then the urethra is going to form from the caudal end of the urogenital sinus, which will connect the bladder to the outside. Now, the caudal ends of the mesonephric ducts are going to merge with the bladder wall. And then on top of the kidneys, we're going to get development of these adrenal glands derived from intermediate mesoderm. Now, the adrenal glands regulate metabolism and stress response via hormone production. So the adrenal glands are pretty big glands, although clearly not as big as the liver, and they are critical to normal function of your body.